And then also at the bottom, you should see captions. So if you can't hear as well, that should help too. So let's get started. So today it's going to be me. My name is again Kat Ulbrich. I'm the Maryland and Delaware Area Director. As area directors, we oversee a chapter. We help with fundraising, advocacy, education, loss, and healing. So we do many things. And advocacy has really grown on me. We've been doing a lot here in the state of Maryland, and it's always great to see how we can have an impact with advocacy. With me today is Sue Mascaleris. She's our advocacy chair. So she's a board member, a volunteer, and she's been with the Maryland chapter for more than 6 years now. So here's an overview of the agenda today. We will have some opening remarks, provide you an introduction to advocacy with AFSP, give you a brief overview. So on Advocacy 101, we're going to talk about suicide facts and figures. Then Sue is going to go into detail about the Maryland policy priorities. So these are the priorities that we're going to present to the legislators. While there are a lot of bills, I was going to say hundreds of bills, but a lot of bills here in Maryland are related to mental health and suicide prevention. So we're working a lot on the back end with legislators, but really want to focus on 3 priorities this year. We're also going to talk about how you can take action, and then we're going to open it up for questions and answers. So the AFSP Maryland chapter has been hosting a state day for 6 years now. So usually we meet in Annapolis for one day. We meet with you guys, our field advocates, and we do an introduction, and then we go from office to office. And of course, we haven't been doing this for 2 years now. I think this is our second virtual advocacy day. But regardless, the virtual space gives us the opportunity to still connect with legislators. It even gives people from more rural areas that don't want to travel to Annapolis the opportunity to connect with the legislators. So actually, I think it's quite easy now to connect with them. In the left top corner, you see our advocates in Washington, D.C. So each year we also send board members to D.C. to advocate there. There's a 3-day forum where they learn about advocacy and then also meet with legislators. But we also do advocacy throughout the year. So we invite legislators to join us for the Out of the Darkness walks, other events that we host. We try to connect with them as good as we can throughout the year to keep in touch and also be a resource. So whenever there is legislation coming up about mental health or suicide, we can serve as a resource. And on top there on the right corner, you see the suicide proclamation for Suicide Awareness Month that we received last September, which was really exciting because it especially mentioned AFSP as a resource and acknowledged the efforts that we have accomplished and trying to accomplish here in Maryland. So introduction to AFSP advocacy. AFSP volunteer field advocates, that's what we call you, our volunteers, your field advocates, make an impact in many different policy areas for suicide prevention and mental health. Policy priorities are determined every 2 years by volunteers on the National AFSP Public Policy Council and the Public Policy Office staff in Washington, D.C. So in D.C., we have an office with 5 staff members that review policies, that check out the bills, help us write testimonies, and support us in our efforts. The staff works with the chapters to determine which policies will make the biggest impact for each state. And you can visit afsp.org priorities to find more detailed information on our top policy issues. You can also download the state policy and the federal policies. I think I emailed them to all of you, but if not, you can always go to afsp.org/priorities. So now here's a short video that highlights the impact that thousands of AFSP advocates across the country are making by being part of an AFSP State Capitol Day event.
Each spring, AFSP volunteer field advocates storm state capitol buildings across the country. They raise their voices in support of suicide prevention policies that can save lives. State Capitol Day events allow advocates to meet with legislators, share their stories, provide resources, connect with the community, and save future lives. AFSP advocates are making an impact across the country, sharing one message: suicide is preventable. By creating connections with public officials, AFSP advocates raise the volume of protections for the LGBTQ community. Resources, training, and policies for K-12 schools and higher education. Training and programming for veterans, first responders, and healthcare professionals. Mental health parity, and state suicide prevention plans and initiatives. Join the thousands of AFSP volunteer advocates across the country who are bringing hope and saving lives through advocacy. Together, we are changing the landscape of mental health and suicide prevention. Visit afsp.org/advocacy for more information and to sign up as an AFSP volunteer field advocate today.
So let's talk about Advocacy 101. So when we talk about suicide, it's important to use safe messaging. AFSP advocates come from many different backgrounds. Some of you have lost a loved one to suicide. Some of you might be struggling. Some of you might be supporting somebody who struggles with their mental health. Some of you have a professional connection to the cause. But by telling your story, you can save lives. And this can only be done if the story is being told in a safe way. Sharing your story lets people know that they're not alone and shows them that recovery is possible. If done safely, your story will encourage people at risk or people who are struggling, people who had a loss, to seek help, to be open about their experience and share it with others. So when we talk about suicide, to begin with, I really encourage you to make sure that you are in a safe place. In your recovery, because even though you're very passionate about something and you've been really impacted by a loss or your personal experience, we really want to make sure that you are in a safe place because you are the most important person here. And we want to make sure that you feel comfortable sharing your story. Please avoid discussing details or share the method unless it is really important for the story. The problem is when we share the method or describe, especially a suicide in detail, it could be triggering for the people that we share the story with. So we also need to keep in mind that not only our fellow advocates that are with us in the meeting, but also our legislators often have a connection to suicide. So just keep that in mind. Avoid glorifying suicide by using terms like successful attempt, but instead say death by suicide. We also try to avoid the word commit. It's often related to committing a crime. And instead we said somebody died by suicide or they took their own life. When you tell your story, you can also share resources like the National Suicide Prevention Lifeline or the Crisis Text Line, or any local resources that you're aware of, things that might help you in your recovery. And then when we go out and talk to legislators, I know this might be intimidating at first, but first of all, keep in mind they're human beings too. They're used to speaking to us, and you can practice your story, right? So that's why we have you write the vignettes. This is a short blurb of your story. Really read this over and over again. Make sure you are comfortable sharing your story to make sure you can then also present it during the meeting. So practice. As you begin your advocacy journey, it's important to understand where you can find resources. So while we provide a lot for you, and this is specific for this event, we try to make it as easy as possible. You can continue to be an advocate throughout the year. So you can go to your state legislative website and look up who are your legislators. You can find their contact information. You can identify sponsors of suicide prevention and mental health legislation. You can, as I just mentioned, find your own legislator. You can follow the process of each legislation. You can also look up bills that are already established. And the easiest way to do so is by going to this website at msa.maryland.gov. We are lucky we have Sue with us, Sue Mescaleras. She is monitoring most of the bills and keeps us posted on hearings, and also our board members submit testimony. So we really have to keep track of how these legislations are moving along. But if you're interested to look into this, it can be quite exciting. We also have additional resources for you to learn more about how to be an advocate. The first stop would be the webinars and meeting videos that we have saved at afsp.org/advocacy resources. It has a ton of tips on how to share your story, how to talk to a legislator, and some other inspirational videos to learn more about how to interact with your legislator. You can also look up issue briefs at afsp.org priorities. So you can look at federal, state. We all shared with you the Maryland issue brief. The bill tracking can be done in our action center. So the bills that we want to highlight during Advocacy Week are listed there right now. So if you go to afsp.org/action center, you can click on the Maryland State Day and send your legislator a quick email to let them know that we're advocating this week and what we're advocating about. And if you go to afsp.org/statistics, you can find fact sheets. There's a fact sheet for the US, and then we have it split up by state, so you can see what the suicide rates are in each state. So when we speak to a legislator or their staff, and I just want to highlight this, talking to their staff is not something to dismiss. Staff are very valuable. They are a great connection to have. They're the ones giving the resources, the information to the legislator, and often they've been impacted by suicide or mental health themselves. So they can be a great advocate for us too. So if we schedule a meeting with the legislator and the staff shows up, don't be disappointed. So when we meet with them, please remember to be polite and thank them for their time. Each meeting is around 10 to 15 minutes, which is quite short. So we need to really be clear about what we are asking, but that's just how they're being scheduled. And then be mindful of your language again, as we just discussed, really making sure that we are using safe language. So in our case, we send a lead advocate with you. So those are volunteers that have a little bit more experience with talking to legislators or have been involved with the chapter for several years, they will take the lead and start the introduction, but then they will hand it over to you and we will ask you to introduce yourself and share your story briefly. So when you share your story, that's the vignette that I've been talking about. It should really be brief and to the point, and it's like an elevator speech, something that you can practice, and that's all we need from you right then and there. In the case you come across a question, so the lead will also help explain the bills that we want to see supported. But in the case the legislator has questions about a bill or something that the chapter does and you do not know the answer, that is okay. We don't expect you to know everything. So if any questions come up, we really want you to send those to me or Sue, and we can either answer it for you if we know, or we can talk to our public policy office in DC and find out the answer. And then we also kindly ask you to get back to the legislator and provide them with the answer. This is something I really want to encourage you to think about while we're advocating this next week and can really interact with legislators. This is a very busy season for them. They talk to a lot of people while they're in session. So advocacy can happen all year round, and you can connect with your lawmakers throughout the year. So whenever you feel like there's something coming up, you want to connect with them throughout the year, you can always email them. You can engage with them on social media, follow them on social media. You can even meet with them, either in the local offices in Annapolis or virtually, which is probably easier. But that's just, checking in with them throughout the year, making sure they know who you are. You can attend town hall meetings or community meetings, subscribe to their newsletters, which is a great way to find out, what are their priorities, what are they focusing on. And then we also look for testimonies when there are hearings. So if you happen to have a specific expertise, a specific experience, that might be an opportunity to also testify. Each one of you can testify on their own, like we just did for the 988 bill. So you can submit your written testimony, and usually there's no limit on written testimonies, and for verbally we always have a little bit of a limit. It's usually depending, I think it's 2 and 5 depending on whom you're talking to. So just really make sure that you know who your legislators are and try to figure out what their priorities are. If you can engage with them throughout the year, it's a good way to keep suicide prevention on their mind. So here are some facts and figures about suicide. So this is the data from 2019. The data from 2020 is currently being processed by the Center for Disease Control. We have preliminary data, but it's not 100% official. We haven't received the actual numbers. So I'm just going to stick with the 2019. Once the new ones become available, I will share that with you. But in 2019, we lost 47,511 Americans to suicide. This makes suicide the 10th leading cause of death, the second leading cause of death for ages 10 to 34, and the fourth leading cause of death for ages 35 to 44. 36.5% of people who died by suicide were 55 and older. And it's estimated that for each suicide, there are at least 25 attempts. And so that equals 1.4 million suicide attempts each year. This is a map of all states. As you can see, Maryland is in the lower third of the suicide rates compared to other states. Despite the fact that we are in the lower third, I want to just emphasize that suicide prevention continues to be important. We still lose hundreds of Marylanders to suicide. So It's definitely something that should be on top of everybody's mind. In Maryland, we lost 657 Marylanders in 2019. It's the 11th leading cause of death overall. It's the 3rd leading cause of death for our youth and the 4th leading cause of death for ages 35 to 54. I shared with you the suicide data from Maryland. So that is a great sheet to have handy during your meeting. We will send it to each legislator ahead of time, but it's just something that you can print out, have ready, so you can also reference it. And now I'm going to hand it over to Sue to talk about our Maryland policy priorities.
Hello, everybody. Can you hear me?
Yep, loud and clear.
Okay. Our first priority, and this is the big one, is the 988 Trust Fund. On July 16th of this year, the National Suicide Prevention Lifeline phone number will transition from the familiar 10-digit 800-273-8255 to the easier to remember 3-digit 988 number. Just as 911 is the emergency number you call when someone needs help with a physical injury or illness, 988 is meant to function as the number you call when you have a mental health or mental or behavioral health emergency. Starting in July, all calls to 988 will be directed to the local Lifeline call centers. According to the Substance Abuse and Mental Health Services Administration, SAMHSA, quote, "The creation of 988 is a once-in-a-lifetime opportunity to strengthen and expand the Lifeline and transform America's behavioral health crisis system to one that saves lives by serving anyone at any time from anywhere in the nation." Next slide. Oh, I'm sorry. There we go. No, go back. The National Suicide Prevention Lifeline was established in 2004 and is a national portal that connects callers to localized call centers and services. It is not one national call center. The Lifeline is a network of independently operated, independently funded state and local call centers. In Maryland, we have 8 affiliated call centers that handle Lifeline calls. 3 of those centers have text and chat capability. Ideally, callers to the Lifeline are connected with a call center in their own state. If a local call center is unable to answer a call in a specified time, the Lifeline reroutes calls to one of 9 backup centers in their network. These backup centers may be out of state to the caller. To give you an idea what we're talking about, the in-state answer rate for Maryland for the months of April through June of 2021 was 85%. That meant 85% of the calls were answered in the state of Maryland. The goal for 988 answer call rate is to be similar to what the expectation is for 911 centers. That is 95% of the calls answered within 20 seconds. The number of calls to the Lifeline has increased since the start of the pandemic. It is estimated that the call volume will increase even more once the Lifeline 988 transition happens in July. Next slide. It's important that calls to the Lifeline are answered locally by local in-state staff who are trained to respond to mental health emergencies and who are familiar with the local mental health and behavioral crisis response services. In most cases, mental health crises can be de-escalated over the phone. As I said before, the calls to the Lifeline have increased since the pandemic started, and we expect it to increase even more in July when the 988 goes online. The Lifeline has proved to be an essential component in suicide prevention. However, local call centers face barriers to their continued success, especially with increasing call volume. These barriers being insufficient funding and limited capacity to respond to increased call volume. Next slide. Although the Lifeline is a national program and it does get federal funding, that money does not fund local call center operations. Local centers depend on funding from the state and local contributors, private contributions, and many rely on volunteers to staff their operations. Therefore, it's critical for state governments to provide funding to crisis call centers within the Lifeline network to make sure that the calls are answered in state in a timely fashion. Next slide. A little bit about the history of 988. In October 2020, the National Suicide Hotline Designation Act became law. This legislation designated 988 as the future 3-digit phone number for the National Suicide Prevention Lifeline. It requires the 988 number to be up and operational and go live on the 16th of July of this year. Finally, it empowers the states to enact laws allowing for 988 to be funded in the same way as 911 through monthly customer service fees on monthly phone bills. Many states are proposing legislation to do just that. Maryland has chosen to take a different approach to fund 988 system by establishing the 988 Trust Fund. There are funds dedicated to support the 988 system from various sources will go. The legislation that establishes this trust fund is in the Senate, Senate Bill 241, sponsored by Senator Augustine, and House Bill 293, sponsored by Delegate Karen Lewis Young. The Behavioral Health Crisis Response Services 988 Trust Fund. These two bills are identical. It's typical for bills, for the same bill to be started in both houses. It saves time. These bills have been introduced in the Maryland General Assembly. The House bill has had its hearing, and the Senate bill will be heard tomorrow in the Senate Finance Committee. Next slide. What does this legislation do? It establishes the 988 Trust Fund, which will provide reimbursement for costs establishing and maintaining the continuum of behavioral crisis care, including call centers, mobile crisis teams, and crisis stabilization centers. Next slide. Okay. In addition to establishing the 988 Trust Fund, we are asking the governor and the General Assembly to dedicate $10 million in state funds for fiscal year 2023 to support local call centers during the launch of the 988 system. The 8 Lifeline call centers in Maryland currently receive no dedicated funding from the state specifically to support Lifeline call, text, and chat services and their follow-up. Additional funding will be required in the coming years beyond this initial $10 million deposit. State general funds should supplement other federal and local sources for 988 services, and funding strategy should be revisited and refined over time based on current call, text, and chat volume and workforce capacity to respond. Next slide, please. Timely access to mental health crisis services saves lives. We know this. So AFSP has been urging every state to pass legislation for 988 funding. This legislation is happening all over the country and in every state. Call centers have the capability to answer, increased call volume. Callers can be connected 24/7 with a center in their own state. And call centers are equipped with resources to connect callers with wraparound services and care. This is what our goal is. And there you see, on the top there's the National Suicide Prevention Lifeline. You can see that number. In July, it will become 988. Okay, priority number 2 is the establishment of the Maryland Suicide Fatality Review Committee. Next slide. SB 94, sponsored by Senators Eckert and Carrozza, and House Bill 48, sponsored by Delegate Bill Castro. Public Health, Maryland Suicide Fatality Review Committee. Our second priority is the establishment of Maryland Suicide Fatality Review Committee, which will aid in timely suicide data collection and analysis. This, as I said before, SB 94 is sponsored by the Senators Eckert and Carrozza. The identical bill is sponsored by Delegate Bill Castro. Maryland has already taken an important step toward better understanding the circumstances that precipitate suicide deaths by taking part in the CDC's National Violent Death Reporting System. This state-based surveillance system contains linked data for medical examiner reports, law enforcement reports, and death certificates for all suicides, homicides, and other violent deaths. In many cases, these records also contain narratives with more detailed information collected from these reports on the events or situational factors that occurred right before those deaths. However, currently there is no systematic review of these important data and narratives to regularly inform prevention strategies. We're therefore asking the General Assembly to pass SB 94 and HB 48. Current status of these bills. Both bills have had hearings in the committees. Just to a little legislative 101. Every bill that goes into the it goes into the House and the Senate must first go, they're assigned to a committee. A committee hears that bill. If the committee does not vote that bill out with a favorable report, the bill is dead. For all effects and purposes, it's dead. So it has to pass through the committee. A favorable vote in committee is a good thing, in other words. The Senate bill received a unanimous favorable vote in the Finance Committee. In fact, right before the vote, the entire membership of the Finance Committee signed on as sponsors. SB 94 will go to the floor for the entire body to work on probably Tuesday or Wednesday. The House bill has not yet been voted on by the House Government and Operations Committee. Next slide, please. Data collection is important for suicide prevention efforts overall, especially for those committees that are at increased risk for suicide, including LGBTQ, youth, and veterans. In order to design effective suicide prevention strategies, we must ensure the availability of complete, accurate, and timely information about deaths by suicide. We need to know who is dying by suicide, the circumstances surrounding those deaths. It is even more vital when we look to increase the effectiveness of prevention efforts targeting high-risk or underserved populations. The data we get from the CDC has a lag time of 2 years. Anything we can do to get and analyze more current data will help us better see trends and target our prevention efforts where and when they are needed most. Next slide. Our third priority is the establishment of the Commission on Student Behavioral Health and Mental Health Treatment. Next slide. HB 56, sponsored by Delegate Bagnall, would establish a commission to study, evaluate, and update and revise guidelines for student behavioral health and mental health treatment and services. This includes investigating unique behavioral needs of students from different racial and ethnic backgrounds, making recommendations on actions needed to improve current practices, and researching ways to coordinate school-based practices and healthcare provider practices to improve available treatment options. Next slide. Maryland, children and teens are continuing to experience significant stressors and disruptions related to the pandemic. Virtual learning, being separated from their peers, loss of family and friends to COVID have had a huge impact on our children. Rates of psychological distress among youth have increased. The number of young people visiting emergency rooms for mental health emergencies and suspected suicide attempts have increased as well. Even pre-pandemic, mental health challenges were the leading cause of disability and poor life outcomes in young people. Youth spent a significant amount of time in school and under the supervision of school personnel. Teachers, counselors, school employees see our children every day, see their interactions with peers, and are in a position to notice changes in their behavior or academic performance. Our schools have an important role to play in addressing and supporting student mental health. Okay.
Thank you, Sue. Just to close out, I'm just going to talk about the actions that we're going to take in the next couple of days, weeks, and how you can support us. So after this meeting, if you haven't done so yet, I will send out an email, again, a reminder, but please go to afsp.org/action center. You can take action today. There's an email already prepared with everything that we are asking our legislators. All you have to do is send. It's a very easy way. If you have trouble doing so, you might just have to register again, but it usually takes 2 minutes to do so. So please do that if you haven't done so. The Action Center will be open for a whole week, but I would prefer if you take action now. If you can, and some of you or most of you already signed up, you can meet with a legislator. So we are currently scheduling tons of meetings. It's a little bit hectic on our end, but as they come in and as they're being confirmed, we let you know what time and the Zoom link. If you have not signed up as somebody who wants to meet a legislator, but you just changed your mind and you really want to talk to a legislator, please let me know. That's not a problem. We can definitely get you signed up. Please finish or send me your vignette. This is really important. This is the way we share stories with legislators. We send the vignette before a meeting or after. This gives them a face to the story and a great way for us to continue sharing our personal stories. You can engage in your community, as we talked about before, with the legislators, or by also recruiting other advocates. So when you become a field advocate, you should get like 1 or 2 emails a month at the most with any actions that you can take. It takes 2 minutes to do so. So please sign up if you haven't done so, and encourage others in your community to sign up as well. You can always be active on social media. You can tag us with AFSP Maryland, AFSP National, or AFSP Advocacy. If you want to, you can also add your legislators. So when we do the bills, you can also go to AFSP Maryland and see examples of what I'm doing this week by thanking our legislators for legislation, tagging them, raising awareness. So if you do this throughout the year, that would be great. This is what the Action Center looks like. So when you go to our website, just look for Maryland State Day. Click on the send your emails, and then your email will pull up. It will show you your legislators. And all you have to do is add a little blurb if you want to, a personal note, but you don't have to. And then just click on send. Just make sure your name is on there so they know it's coming from you. So again, for those who are meeting with the legislator, if you registered the later part of last week, we're still scheduling meetings for you, so be on the lookout for that. But again, when you have this 10-15-minute meeting, the lead will introduce themselves and AFSP, and then it's your turn to introduce yourself and share your story. The lead and you can utilize the issue brief and the state fact sheet that you all should have. If you don't have it, please let me know. We want to highlight the issues on the issue brief, but because there are 3 big issues, if you feel like you're a little bit rushed and you feel like you want to prioritize one or the other, just pick one that you are familiar with, that you feel comfortable with. You can also split them up between different people. So if you have 4 people on that call, each one of you can address one issue. Also, make sure that at the end of every meeting, you offer AFSP Maryland as a resource in the future, or in general, if you're in contact with your legislators throughout the year, please let them know that we are here to help and we can always be a resource. And if they are seem interested in learning more about what we do and also want to attend any of our events, please let them know to go to afsp.org/Maryland. All our events are listed there. We have trainings that are mostly hosted virtual, but we also have some walks coming up and a hike for hope, etc., which we're going to talk about in a second. This is what the vignette should look like. So it has your name, the city that you live in, and then a short blurb about your story. Please send them to me. I want to review them first, and I save them in a folder. I usually send it to your lead. If I was not able to do so, then you can send it to your lead. The lead shares it before the meeting or after in the thank you. And again, make sure that at the end of the meeting, they know that AFSP is here as a resource. Just quickly watch that video. This is a this is a video about what a meeting can look like.
Want to make a difference for suicide prevention and mental health? Want to get the attention of your public officials? Want to save lives through advocacy? Here's how. Public officials listen to their constituents, and that's you. Advocating for suicide prevention is easier than you think. So get ready to take action, advocate, and save lives.
When advocating at the state and local level, and sometimes at the federal level too, you may have the opportunity to meet with your public officials. Today, we're meeting with Council Member David Grasso.
Get organized. Have the materials you plan to share ready. You must be on time to your meeting. Early is better. Decide who is leading the meeting before you get there. Practice sharing your story out loud. You might want to do this in front of a mirror or with a trusted friend or family member. Keep your story to 2 to 3 sentences, 30 seconds or less. Decide what you are asking for and how you are going to ask for it. Collect yourself before the meeting. Calm those butterflies, and now you're ready to advocate. Introduce yourself. Thank the council member for meeting with your group.
Council member, it's great to see you again. Taylor and I are here today representing the American Foundation for Suicide Prevention for our first ever advocacy day here in the district. So thank you so much for taking the time to speak with us.
Well, it's my pleasure.
Ask how much time for this visit.
How much time do we have today?
Thank the council member for previous support, if applicable.
It just means so much to me, both personally and professionally, that you introduced the Youth Suicide Prevention and School Climate Survey Act back in 2016 to require educator training and school policies in suicide prevention. Thank you so much for your leadership, for being a true champion on this issue.
Share your personal story. Ask other group members to briefly share their stories.
I've been with the foundation for about 10 years now, since losing my brother to suicide. He was in high school when he died, so it just means so much to me.
So I'm also a field advocate, and I have a number of family and friends who struggle with their mental health and with finding the necessary resources.
Share the AFSP national and state fact sheets and underscore that suicide is preventable. State there are steps the council member can take to support prevention efforts and share the talking points and legislative needs.
As you can see here, suicide is the 15th leading cause of death in Washington, D.C., the 10th leading cause in the country, but we know it is preventable.
Which brings us to our two asks of you today. The first bill would require regular training for health professionals in suicide assessment, treatment, and management.
And the second bill we'd like you to support would address suicide prevention on college and university campuses. We've also included some language for a resolution making September Suicide Prevention Month, if you'd be interested in introducing that this year.
That's great. I really appreciate the advocacy, and obviously I'll look closely at your materials. In fact, I'll be happy to put you in touch with my staff as well to make sure that they have your contact information and you have theirs to work on these bills as well as perhaps introduce the resolution. So thank you.
Request to take a picture with a council member if time. Give folder to the council member, shake hands, and be sure to say thank you for their time. Write down notes from your meeting so you can report back to the AFSP Public Policy Office. So that wasn't so hard, was it? Your AFSP advocacy does make a difference, whether it's on the local, state, or federal level. Start planning your meetings with your public officials now. The AFSP Public Policy Office is here to help you along the way.
So for those who have never met with a legislator before, this might be a little bit uncomfortable or overwhelming. So really feel free to lean on your lead advocate. Also make sure that you, this is a Zoom call, but just make sure you dress business casual because we still can see that. And please keep in mind that you represent AFSP. So this is about the legislation that we shared with you, the issue brief. This is about the work that we do. We want to share your personal story, but please keep in mind that we don't represent other organizations or your business. While we appreciate your personal opinion, please make sure that this is really clear that this is your opinion and not that of AFSP. Also, we keep saying AFSP. For legislators, it might be easier if you say the American Foundation for Suicide Prevention. I know that's a mouthful, but they're often not familiar with the acronym, so it's often easier to say the whole thing. So here are some final reminders. When you finished your meeting, you can coordinate with the lead who will submit the meeting feedback. Sorry, so I also send you the paper so you can take notes while you have the meeting. It's always great when somebody takes the lead and talks and the other person takes notes and vice versa. So really make sure that you're clear about this. That's why you should meet 5 minutes earlier. So try to get on that call a little bit earlier. And then send the thank you email to the legislative office. Again, please coordinate with the lead and make sure that you're not sending two separate messages. If you have any questions at any time, please email me. That's often easier. You can also call me at 202-770-8973. But email is often the easiest because I can answer while I'm in a meeting. What is happening? Can everybody still see my slides? So here are some of the upcoming events. I really encourage you to join us for our volunteer orientation on February 17th at 7 p.m. It's all virtual. And then for our Talk Safe Lives on the 23rd. This is a basic introduction to suicide prevention, but it's essential to understand what we do, how suicide works, how we can prevent it. So if you've not seen it, please join us for our Talk Saves Lives. It's a really great way to learn about suicide prevention. On March 14, we are going to host a workshop for suicide loss survivors. It's a 2-hour workshop where Dr. Jordan, who is an expert in postvention, talks about suicide 101, prevention, but you can also ask him questions. All of April, we are going to have our campus Out of the Darkness walks at 5 of the Maryland universities. We're also working on some high schools. Then in May, we are going to have our Maryland Hike for Hope and our Pause for Prevention walk, which is a dog walk. And then in fall, we're going to host the Out of the Darkness community walks and the Marine Corps Marathon. And 10K has a Team Maryland. So if you're interested, if you're a runner, a walker, please join us and help us raise awareness. All of these events can be found at afsp.org/Maryland. Here again is my contact information and that of Michelle. Michelle is our Associate Air Director. She can help in Delaware and Maryland. And Sue is our Advocacy Chair. So if you have any specific questions about a bill, that should go to Sue. She knows everything about those bills. So thank you for joining us today. I really appreciate you taking time. I'm sure it's been a long day for everyone. If you are scheduled for meetings and have any questions, please reach out to your lead or me. We'll definitely want to make sure this is a very comfortable experience for you and you will see it's not that difficult. I also encourage you to follow us on social media at AFSP National and AFSP Maryland. That's a great way to stay engaged with us and make sure that you stay on top of everything that's going on around suicide prevention. So I'm going to stop sharing my screen. And I'm going to open it up for questions and comments.
So for hi there, how are you, Kat?
Hi, Tania.
It's so good to meet you and to see your face. So for tomorrow, I'll be speaking with Greg. Is that what his name is? Okay, as the lead, and then I'll just do a 2 to 3 sentence proposal or just sharing the things that I'm concerned about in regard to suicide in my area.
Right. So
Okay.
Greg is here. You can see him. If you guys meet 10 or 5 minutes ahead of time on the Zoom, you can just do a quick introduction. But Greg is going to take the lead and then he's going to hand it over to you to introduce yourself and share your vignette that we just wrote. So try to stick to that vignette. And if there are any specific questions, you can discuss that in more detail. But again, it's only 10 to 15 minutes, so there's only so much we can squeeze in.
Okay, got it. And just one more question. For the events that are coming up for the workshop or for, I guess, any of the events, is there any opportunities for survivors or victims to share their story, or is there anything that you all do things like that?
So we share stories usually in written form in our blog or at the events. So the Out of the Darkness walks, the Pause for Prevention, we do have opening ceremonies. So yes, that's where we have people who had a loss, survivors, people who are struggling, share the story. So if you're interested, please let me know. And we're always looking for new volunteers, just throwing it out there. So we're covering a whole state, it's big. So please let us know. We definitely need help with the walks, but we also want to raise awareness. We have a lot of training scheduled. And please also let people know that we're here as a resource. All our resources, our trainings are free, so we can definitely come to your community.
Kat, I can also mention that the AFSP has what they call the Lifesaver blog, and a lot of people share their stories on that way. Anybody who's interested, I can send them the form. Is it the
I
form
can include it in the email afterwards.
Can I get a copy of the slides you used tonight?
Yeah.
because I missed some of the information.
That's okay. I'm recording this too, so you can also go back to that. But the slides probably easier to read.
So I have a question. Jamie Raskin has been talking about 211 for mental health issues. That seems confusing to me that we have 988 and 211. Can we talk about that a little bit?
Jill, do you want to be the troublemaker today? So this is very confusing, and I totally understand. So Maryland and other states have the two. It's a little bit more confusing here in Maryland, though. So we have the National Suicide Prevention Lifeline that goes to the 8 call centers, and we have 211 press 1, which goes to 5 of the same crisis centers. So these crisis centers answer both hotlines, right? So whether you call 211 or 988, they go to the same crisis center. 211 is funded by the state. 988 is not. So 988 currently is funded nationally or through donations, grants. That's what we're trying to accomplish with that trust fund. So the trust fund should come from state funds and go into 988. So this is not a competition. It doesn't really matter whom they're calling, but with 988 rolling out, this is just going to be a national initiative. So people are going to hear about this in the news, on TV. We're going to blast it out. So people are just going to learn about this, and probably the caller volume will increase for 988. This does not mean that 211 has to go away or we cannot work that in. It's right now, it's really focusing on how are we funding 988 within the state, because it's not being funded.
Are there any efforts to combine the two?
Maybe down the road. So
Okay.
other states have also 211. In Maryland, 211 is it's a little bit more advanced because we have the press 1 that goes specific for mental health. We just added the Raskin text line. So it becomes a little more confusing. The state invested a lot of effort into establishing 211
Okay.
as the number, right? But what the plans are down the road, I have no idea.
Okay.
So maybe that.
No, I like these all to be.
No, it's very confusing, and we didn't even know that all these calls go in the same center. So it does for you in crisis. It doesn't really matter if you call 988 or 211, but 988 is available nationally and it's going to be promoted that way. So I think more people are going to start calling 988. Also, I see 988 as equivalent to 911, right? So when I have a mental health emergency, I'm going to think about 988. This is going to pop in my head. So this is, I think, the goal of the 988. So down the road, maybe 211 is not relevant, but right now both function and both reach the same crisis center.
Are we talking to Jamie Raskin to say maybe think about 988?
Is Chelsea still on the call? Yeah. Chelsea, any comments on that? Chelsea's from our public policy office in DC, but I don't think this is such a switch that we can do right now. It's not. And 211 does a lot of other things too. So if you have trouble with housing, food insecurity, other things, so that's what 211 is good for too, and 988 cannot help that much with that.
Yeah, we can always, hi everyone, I'm Chelsea Diamond. I'm our Senior Manager of Public Policy Events and Projects out of our DC Public Policy Office. Jill, you bring up a really great point, and as Kat mentioned, you know, Maryland is not alone in having multiple numbers that folks can dial. The biggest thing is going to be education. You know, we can certainly meet with legislators and let them know that it would be beneficial to combine the lines, but for the time being, it's just important for folks to know, you know, this is what 211 is for, this is what 988 is for, and this is when you should call 911. So as much as we can educate folks on kind of those areas now, leading up to the release of 988 in July of 2022, the better off we'll be. But I think, there's certainly more conversation to be had down the road about how all of these systems are going to coordinate with one another.
So some of your
Thank you. I
legislators
didn't
have
mean to be a troublemaker,
no,
but thank you.
so some of the legislators have been trained to advertise 211, right, as the Maryland resource, and it's definitely easier to remember than a 10-digit number. So it's going to be hard for them to understand why now, we're coming up with this new number, which is not new, it's always been around. So it's just going to be hard for them to wrap their head around, but just make sure that they're aware of that both lines will be live at the same time. So either way, they can get help. But 988 might be down the road, the 911 for mental health.
I think also too, this is Sue, 988 is it's going to be marketed nationally. So theoretically, I mean, those of us who live in Maryland, we're familiar with 211, but say a tourist from North Dakota may not be as familiar. And if they should have a mental health crisis, this just saves them instead of having to Google what is the number of the lifeline, they can just say, oh, 988, and they call 988. So it's just going to be, it's a national thing, so that you can go anywhere in the country, you can go, and if you need help, you know that there's a number there that you can call.
So all your leads also got a little bit more notes on 211. So they can also help you with that question if it comes up, and we can always do a follow-up too.
Hey, Kat.
Yep.
They were talking about HB 56 and Representative Bagnall. Do you have meetings with her? I know she's a big supporter of AFSP.
Yeah, so Sue has a meeting scheduled, I think, on the 15th. So if anybody wants to join, she's been a huge advocate and a huge help for us. Yeah.
It's the 15th.
I can send you the time. I can look it up.
Okay. Yeah, I know her, so I wouldn't mind. I can sit in too. So.
Yeah. If you know a legislator personally, that's great. That's an extra that's help. But again,
okay,
also
I've met her a few times.
Yeah, they're all very friendly. And also if you meet with their staff, again, don't be disappointed. Really, staff has been so helpful to get legislation going, or just to give us advice or help us along. So don't be disappointed. Any other questions? If you have not heard from us yet, then we have not heard from your legislator yet. So just be on the lookout. We've been trying to schedule all these meetings, and it sometimes takes a couple of days for them to respond. But we try to get you on the books. If sometimes we have meeting with committee members of the bills that we want to see supported, but we don't have constituents, then we just ask you randomly if anybody's available, and you can join in and share your story. So you don't always have to be a constituent. Okay, so if nobody has any questions, I'm going to hang back for a few seconds. If anybody wants to talk, please email me. I'm just going to send you guys an email about the Action Center. I'm going to include the slides, and maybe the recording if I get that done. And throughout the next 2 weeks, just let me know if you need any help. If you have not submitted your vignette, please send it to me. I just need to review it. And then if you have any questions, please lean on your lead. They're really here to help you. Okay, So I hope you have a great rest of your evening, and thank you so much for spending this evening with us. Talk to you soon.
Thank you. Bye.
Thank you much. Well done.
Thank you. Thank you.
Thank
Bye-bye.
you. Good night.
Bye.
Thank you.
Have a good night.
Great session. Thank you.
Thank you, Steve. Michelle, was there anything in the chat that I missed? Except for your privacy?
Don't worry about it. You're good. Oh, do you have other messages yourself, maybe?
Yes. I have some private messages.
Yeah, I need the information on the bag number.
Amy, you're all set, right, with Dorothy?
Yes. Is Dorothy the lead for the meeting?
Yes. So
Okay.
Dorothy is still on the call too, but she also provided testimony for the first two bills. So she's really a good resource to be with.
Okay, so after I share my vignette, do I talk about a bill or do I just?
Talk to your lead about that. If you're not comfortable, they can take the lead. But if you want to focus on one particular one, you're more than happy to share that.
Okay.
So just, it's not a must. Okay, don't feel like you have to. The lead, they know that they have to do it. For you, it's an option.
All right, thank you.
You're welcome.
Good night.
Good night.